Hi, Susie here. Segment is called Diagnosis Nightmare. I'm using myself as an example, but getting the correct diagnosis code or correct diagnosis is more important than you think. But getting the right ICD-10 diagnosis code is required for understanding your disease, but more importantly, documenting your disease correctly so that if you are applying for disability, both private and SSDI, you have a greater chance of receiving that for legitimate reasons. Small fiber neuropathy has a main code with two supporting codes. Sjogren's has a main code with about 15 supported codes. And to meet the disability requirements for the patient that has Sjogren's syndromes, you've got to show that it affects at least two body organs or symptoms and causes at least two constitutional symptoms like severe fatigue, fever, malaise, da 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 da. Here's the thing. Your doctor might have diagnosed you with Sjogren's and then diagnosed you with a main diagnosis code of peripheral nervous system involvement or peripheral neuropathy. But if they don't use the Sjogren's syndrome with peripheral nervous system involvement, it doesn't count for you. It has to be underneath the heading of the major main diagnosis code. And I'm going to post my table of my actual diagnoses. My doctors have not documented the diagnosis codes like this until recently. So we can help our doctors by asking them to consider sequencing with the other related codes and making sure the documentation lines up and is accurate. And with that said, always document. Use a tracking document, even if you don't do it 24/7, and make sure when you go in to see the doctor that they understand why you're there. You understand what they're looking for once you tell them, and that the plan of care actually addresses why you went there, and that the documentation supports and represents that office visit to the best of their ability. So later I'll post that document. I think it makes more sense when you see it, but I wanted to get this out there, so I recorded it, and just keep your eyes open and reach out if you have any questions.